Welcome to Dermat Vet. Dear friends, beautiful surrounding as usual. Beautiful morning. Just now I saw some of the peacocks and squirrels. They were playing next to me. Dear friends, last week one of my clients came to me with his dog who was suffering from oral hematoma. And he said, "Doctor, I want to treat it." I said, "There is only, I can do it by surgical corrections." But he said, "I am having a wedding in my house and I want to delay the procedure for some days." And accordingly I treated it so that at least the wedding can be performed at home, because after surgical corrections there are various precautions which have to be taken. So today we are discussing about oral hematoma in dogs, management of oral hematoma in dogs. Drainage and repair of the hematoma should be discussed with the owner first of all. We have to take owner into confidence whenever there is oral hematoma. Numerous options exist. First, as I told you, is surgical correction. Second is cannulation. Third is suction drain placement. Then punch biopsy technique and laser technique. The prognosis is good for any of these treatment options. If drainage is not accomplished, the hematoma will eventually coagulate and organize, making surgical repair much more difficult. Scarring is a common side effect of untreated oral hematomas. Ear swab technology should be performed to evaluate organisms in the ear canal. Otoscopic evaluation should also be performed whenever there is otitis externa. See dear friends, whenever there is otitis externa, there is oral hematoma. These two things go hand in hand. So this may be due to any of the several factors, including the allergic diseases, endocrinopathies, parasites, neoplasia. It may be a foreign body or cornification defects. So secondary bacterial or yeast overgrowth is also commonly noted during management of oral hematoma. So procedure for correcting oral hematoma. First is sedation. Second is aspiration of exudate from the pinna. Third is 1 milligram dexamethasone to be instilled at the site of the hematoma. So 1 gram dexamethasone instilled at the site of hematoma is the third step. Reversal of sedation and then giving 2 milligram of dexamethasone intramuscular. This is a procedure for correction of oral hematoma if we have to avoid surgical intervention for few days. Dear friends, otitis externa should be managed aggressively to aid the healing of oral hematomas. Oral prednisolone may be administered for the few days to reduce the inflammation. So this was all about diagnosing and treating oral hematoma and managing oral hematoma in dogs. I hope you found this video informative and interesting. Please share with your pet families, pet friends, vet partners, vet doctors, vet students, and consider subscribing Dermat Vet if you found this video informative and interesting. And please don't forget to press the bell icon to get notifications from Dermat Vet.